Our philosophy on hair transplant is physician focused. So I, as a physician, do all the consults, all the follow-ups, but during the procedure for hair transplant, I do all of the extractions, and I have two very experienced technicians that assist, but I also do all of the implantations. This is important because for me as a physician, I look at every patient from a medical perspective. I don't look at it from a sales perspective. And that allows me to really provide optimal care and also stage the care. So our philosophies with hair transplant are based on about 4 or 5 different principles. And a lot of it is based on what I went through as a patient getting hair transplant. So I had follicular unit extraction twice. I've had 3,500 grafts. I would be bald without this, having undergone it before, and I'm very happy. But during the experience of getting hair transplant, having my head shaved, feeling isolated socially, it was just a little bit more painful to be laying on a shaved head. And about 4 years ago, when I came up with more of a master plan for the practice, and after seeing a lecture at one of our society meetings of a shaveless technique, I thought, I want to be a shaveless FUE physician. I want to focus on this. And we've gotten to a point with doing shaveless FUE that we may be the #1 practice in the country doing shaveless FUE. I saw some data recently that said that 10% of practices are offering a shaveless FUE, meaning that individual hairs are cut, we leave everything else long, and we graft around. And only 10% of their patients, of the 10% of practices that offer shaveless approach, are offering it to their patients. 60 to 70% of my patients opt for a shaveless approach. In fact, I will not do a shave procedure on a female patient. And the key with the shaveless approach is, for one, concealability. It is so important to be concealed afterwards. Secondly, it's quick healing. The donor site is not exposed. And if it's not exposed, that means half of your head is not privy to the public or work, which means instead of taking a week or 2 off from work, you're actually able to go back in a day, 2, 3 days. That's huge. So it fits into people's lifestyles. The other aspect of hair transplantation with FUE is on the fact that I'm picking the hairs because I'm actually coring the hairs. I like using small, sharp punches so that the donor site is saved. I also like taking partial grafts so that if procedures in the future need to be done, we're not, wiping out the donor site. There's still plenty left. So management of the donor site, and then last principle is what does the recipient site look like, and that is where the grafts go. We use pen implanters, and pen implanters allow me as a doctor to actually place each graft. And there are a number of advantages. For one, if you want the hair to go in this direction, you stick it in that direction. If you want it to go that way, it goes this way. It's a stick in place. We don't have to do scalpels. We don't have to do extra medicine to lift the skin off the scalp. All of those things create more swelling, more downtime, more bleeding, more pain. With the pen implanters, I can do it without any extra medicine, and the stick in place is with minimal bleeding and with minimal pain. So the combination of concealment, graft selection, and recipient site placement sets us apart as a very unique practice.